Periodontal disease is a progressive disease that affects the oral cavity. We see bone loss, tissue loss overall, and we want to slow that down for our patients. It is something that you have to address every single day, because if not, it just continually gets worse. Where OraCare comes into play with Perio is that it is that tool they can add to their toolbox to be used on a day-to-day basis to slow that progression down. Most dental professionals that are treating perio in office do use chlorhexidine, and then they typically transition out of chlorhexidine to something over the counter because we know we aren't supposed to use chlorhexidine for long term. However, sometimes patients will continue to use chlorhexidine for an extended period of time, and then they have the side effects of chlorhexidine. OraCare is better than chlorhexidine for a number of reasons. I would say the one that stands out the most to me, and I think that causes dental professionals to seek an alternative, is the staining and calculus buildup. OraCare doesn't have any of those types of side effects. If we go a layer deeper and look at the additional side effects of chlorhexidine, I think we can see why most dental professionals are looking to eliminate the use of chlorhexidine altogether. And that's because of the impact that it has on the cells in the oral cavity, the fibroblasts specifically, how it's now being told to us that it's contraindicated for periodontal disease, for implants post-op. None of us should really be using it anymore, but for a long time, it has been the only choice. OraCare is now offering an alternative as the only other professional rinse available on the market.